My name is Tierney. I am a board-certified pediatrician at Carousel Pediatrics. As cliche as it sounds, I wanted to help people. My mother is a pediatrician, and I remembered as a young child she would bring me to the nursery or her office, and I used to love going in the room with her and seeing the patients. So I knew from a very young age that I wanted to do medicine, especially pediatrics. My greatest joy in being a pediatrician is being able to help sick children, but also being able to see healthy children growing appropriately and being able to identify those kiddos that aren't doing as well and get them the help that they need. So I think my patients appreciate that I like to have a personal touch with them. I call all my own lab results back. I frequently will call a few days later to see how a child is doing after a sick visit if I am worried about them. And nowadays a lot of people will rely on their MA or someone else to call them, but I like to do that personally because I know that I would appreciate that as a patient as well. And I also try to keep on time with my schedule. Of course, there's always days that there's a couple sick children and your schedule gets behind, but I really do try to be respectful of people's time and try to stay on schedule with their appointment times. I hope patients take away from each visit a sense of knowledge and confidence in caring for their children, whether it's a well visit and knowing what developmental milestones to look for in the next couple of months, or a sick visit and knowing how to properly treat a fever or the signs of dehydration. I want them leaving each visit having all of their questions answered and feeling comfortable calling us back in case anything else comes up. The aspect of pediatrics that I'm most passionate about is actually well visits. I love seeing children grow, and that's part of the reason why I went into pediatrics. I love having a newborn come in and seeing them go through all their developmental milestones and go through the teenage years and come out of the teenage years and be a well-rounded, respectful adult, and being able to identify when there are developmental delays to get them early therapy so that they will do better.